Pregnancy is a continuous biological process that begins at conception and ends with childbirth, involving complex physiological, hormonal, and anatomical changes in the woman's body. Understanding how pregnancy progresses from the earliest moment of fertilization through labor and delivery is essential for appreciating why some women experience smooth vaginal births while others require medical intervention, including cesarean section. This progression is not random. It follows a predictable sequence influenced by genetics, maternal health, fetal development, and environmental factors. Pregnancy begins with conception, which occurs when a sperm cell fertilizes an ovum in the fallopian tube. This fertilized egg, known as a zygote, contains the complete genetic blueprint of the baby, including sex, physical traits, and certain inherited medical tendencies. Within hours, the zygote begins dividing rapidly through a process called mitosis while traveling toward the uterus. Over the next few days, it becomes a blastocyst, a hollow structure that implants itself into the uterine lining. Successful implantation is critical. Failure at this stage often results in very early pregnancy loss, sometimes before a woman even realizes she's pregnant. Once implantation occurs, the placenta begins to form. The placenta is a temporary but vital organ that connects the mother and fetus, allowing oxygen, nutrients, and hormones to pass to the baby while removing waste products. At the same time, the mother's body begins producing human chorionic gonadotropin, HCG, the hormone detected by pregnancy tests. Progesterone and estrogen levels rise significantly, signaling the body to maintain the uterine lining and prevent menstruation. These hormonal changes are also responsible for early pregnancy symptoms such as nausea, breast tenderness, fatigue, and frequent urination. The first trimester, which spans from week 1 to week 12, is the most critical phase of fetal development. During this period, all major organs and systems begin to form, including the brain, spinal cord, heart, limbs, and internal organs. By the end of the first trimester, the fetus has a recognizable human form, and the heart is beating regularly. Because organ formation is occurring, the fetus is especially vulnerable to harmful substances such as alcohol, tobacco, illicit drugs, certain medications, and infections. For example, exposure to uncontrolled diabetes or high fever during early pregnancy has been associated with congenital anomalies, which can later complicate delivery decisions. As pregnancy progresses into the second trimester, from weeks 13 to 26, fetal growth accelerates and maternal symptoms often stabilize. Nausea usually subsides, energy levels improve, and the uterus expands upward into the abdominal cavity. During this stage, the placenta is fully functional and the fetus begins to move, a sensation known as quickening. Bones harden, muscles strengthen, and organs continue maturing. From a medical standpoint, this trimester is often considered the safest period of pregnancy, but it is also a time when underlying conditions such as gestational diabetes or pregnancy-induced hypertension may begin to emerge. Gestational diabetes, for example, typically develops in the second trimester due to increased insulin resistance caused by placental hormones. If not properly managed through diet, exercise, and sometimes insulin therapy, it can lead to excessive fetal growth, known as macrosomia. A large baby increases the risk of shoulder dystocia and obstructed labor, which may ultimately necessitate cesarean delivery. This illustrates how events occurring months before labor can directly influence the mode of delivery. The third trimester, spanning from week 27 to delivery, is characterized by rapid fetal weight gain and final organ maturation, particularly of the lungs and brain. The uterus expands significantly, placing pressure on surrounding organs and causing symptoms such as back pain, shortness of breath, heartburn, and swelling of the legs. The fetus gradually moves into a head-down position in preparation for birth. However, not all babies achieve optimal positioning. Breech or transverse presentations are more common in women with uterine abnormalities, multiple pregnancies, or excess amniotic fluid, and these positions often lead clinicians to recommend cesarean section for safety. During late pregnancy, the mother's body also begins preparing for labor. The cervix softens and shortens through a process called effacement, while hormonal signals increase uterine sensitivity to oxytocin, the hormone responsible for contractions. Braxton Hicks contractions, which are irregular and usually painless, may occur as a form of uterine practice. Although they do not cause cervical dilation, they indicate that the uterus is preparing for true labor. Labor itself is typically divided into 3 stages. The first stage begins with regular, painful uterine contractions that cause progressive cervical dilation and effacement. This stage can last many hours, especially in first-time mothers. Effective uterine contractions, adequate pelvic anatomy, and proper fetal positioning are essential for labor to progress normally. If contractions are weak, the cervix fails to dilate, or the baby's head does not descend, labor may be prolonged. Clinically, this is referred to as failure to progress, and is one of the most common indications for cesarean delivery. The second stage of labor begins once the cervix is fully dilated to 10 centimeters and ends with the birth of the baby. During this stage, coordinated pushing efforts and strong uterine contractions move the baby through the birth canal. Factors such as maternal exhaustion, fetal distress, or abnormal fetal heart rate patterns may require assisted delivery using instruments or emergency cesarean section. For example, a sudden drop in fetal heart rate may indicate umbilical cord compression or placental insufficiency, conditions that demand immediate intervention to prevent brain injury or death. The third stage of labor involves the delivery of the placenta. Although often brief, this stage is medically significant because failure of the uterus to contract adequately can lead to postpartum hemorrhage, a leading cause of maternal mortality worldwide. Proper uterine contraction after birth is essential to compress blood vessels and prevent excessive bleeding. Women with prolonged labor, infection, or overdistended uterus from multiple pregnancies are at higher risk of complications during this stage. Throughout pregnancy and labor, the decision between vaginal birth and cesarean section is not determined by a single factor, but by the cumulative interaction of maternal health, fetal well-being, and labor dynamics. A woman may have an uncomplicated pregnancy, but develop complications during labor that necessitates surgical delivery. Conversely, a woman with well-managed medical conditions such as controlled gestational diabetes or mild hypertension may safely achieve vaginal birth under close monitoring. From conception to delivery, pregnancy is a dynamic process that requires continuous adaptation by the mother's body and careful medical oversight. Each stage builds upon the previous one, meaning early health choices, prenatal care, and timely management of complications play a decisive role in determining birth outcomes. Understanding this progression empowers women to engage actively in their care, recognize warning signs early, and collaborate effectively with healthcare providers to achieve the safest possible delivery for both mother and baby.